Thank you everyone for joining us today. As I've mentioned a few times now, my name is Courtney. I work for SCAG as Program Manager for Public Health and Safety. And on behalf of SCAG and the Automobile Club of Southern California, we want to thank you for joining us for a virtual webinar series on the impact of the pandemic on road users. Today's webinar is going to focus on exploring pandemic era data trends and policy implications. Our objective with this two-part webinar series is to help inspire and motivate more practitioners and policymakers to improve transportation safety conditions and protect public health with community-based strategies focused on innovation.
Hey, Courtney, you're on mute.
Oh dear, and I didn't even do it to myself, which is fun. Thanks, Hina, for letting me know. So did people get to hear the introduction at all, or no? I'm gonna think no, that didn't happen. Hina?
A little bit.
Oh, a little bit? Okay, that's most unfortunate. Okay.
The very end of your when you're talking right now.
Sorry. So for everyone joining us, thank you. I just want to share that this webinar will focus on exploring pandemic era data trends and policy implications. Our objective with this two-part webinar series is to help inspire and motivate more practitioners and policymakers to improve transportation safety conditions and protect public health with community-based strategies focused on innovation and resilience. We have another webinar that's scheduled for next Thursday. You should consider checking it out. To kick off today's webinar, though, I'd like to hand things over to Marianne Kim, our partner at the Automobile Club. Marianne?
Okay, thanks everyone, and thanks Courtney. Some of you may already know me. My name is Marianne Kim, and I work for the Auto Club, also known as the AAA here. And I work in government relations and community outreach, and mostly I focus on transportation and traffic safety issues. I'm actually the point person for most active transportation issues, especially those that involve partnerships like this panel series with SCAG Human. I think, and probably all of us will agree that this panel series is timely and important because it really highlights the challenges and some solutions that we face when our transportation ecosystem just suddenly changes around us. All our communities, each and every one of us, have to be more resilient and street smart these days. And I say that even though I really dislike those words. I guess and I'm going to put on my AAA hat here for a second and say that we're doing a lot of work behind the scenes on traffic safety research and trying to just better understand driver behaviors and some of the causes of these collisions that are really dangerous for everyone. So, I mean, some examples are things like distracted driving, impaired driving, things that are dangerous and have the potential to kill all road users. So, I've worked for the Auto Club for a long time, and I know that community partnerships are really important to our programs and policies. We started doing this, traffic safety programs back in the 1930s, and we probably always knew that we can't do this alone, and I don't know if anyone can. So I hope that all of you guys in the audience and the Auto Club and Go Human, all of us, that our paths will cross again and that we can work together in some capacity. Today, I know that we're looking at data trends for during COVID, but I hope everybody is going to be coming back in next week for part 2 of this series. I just want to do one quick note. I think anybody who registered and left their mailing address should have gotten a packet in the mail, or it should be coming soon, that has a free catalog of catalog of all of Auto Club's free classes and education materials that you can order for distribution. If you have ideas that other ways you want to partner with us or work with us through sponsorships or new education materials, we're always open to new ideas. Please contact me. I think my contact information, or at least my email, is on the next slide. So kind of in closing, I just want to say thanks all for coming here today and sharing your next 90 minutes with us. I hope you enjoy this panel, and I hope to see you guys again next week. Thanks, Courtney. I think you're on mute, Courtney.
Yep, I got it. It doesn't always appear when I hover. So thank you, Marianne. SCAG and I appreciate our partnership with Auto Club on events like this. But more broadly, we appreciate our partnerships that we've been able to form through Go Human, SCAG's active transportation safety and encouragement campaign. The campaign supports our member jurisdictions through three main areas: our regional advertising campaign, our temporary safety demonstrations, and educational opportunities on policy and programming that can support active transportation in your community in our region in Southern California. I know, or I think I know, Julia Lippy-Klein, as well as others from the Go Human team, are on the call today, the webinar today. So if you'd like to reach out to any of them for more information, they are here. But I will also add that our Go Human campaign, the primary goals really are to create those safer streets that we need, to increase active transportation use and improve our public health, to support those active transportation investments, and of course, to use data-informed strategies to prioritize resources along SCAG's high injury network. And as I mentioned, we have several staff who are here today in the webinar: Julia Lippy-Klein and others who can be reached out to if you'd like to learn more about how to become involved in Go Human. You can also access our website on this slide before you so that you can learn more about the options and activities that are available to you. So please, I encourage you to visit the website to learn more about our activities and to consider taking a look at the high injury network that Hina, who's also on the line, who helps develop for SCAG. And with that, I'd actually like to hand it over now to John Yee, the Executive Director of LA Walks, who will be moderating today's panel discussion. Welcome, John.
Good morning, everyone. Good to see you all here today. Just want to thank SCAG and AAA for the opportunity to speak to you all. But also, I know we're like months into the pandemic. We're all probably used to these Zoom meetings. But to be honest, I think, to be sitting in a Zoom call to listen about data, these important topics for an hour and a half is a commitment. So I just want to applaud y'all for joining us this morning to be on this call and to do this with us together. So thank you all for coming and doing that. A little bit about myself. My name is John Yee. As was shared, I'm the Executive Director of Los Angeles Walks. A little bit about my background. I'm a community organizer at heart. That's been most of sort of the work that I've been doing. Before doing work on street safety, traffic issues, I was doing community organizing work around tobacco with the Lung Association. Before that, doing organizing work around education. And so my work has always been in organizing. So we do a lot of stories, but not a lot of data. So I'm really excited to see how data can really serve a role in when it comes to organizing. So I think we have a lot of great discussions today. A little bit about LA Walks. We are a community organizing nonprofit. We partner with communities throughout Los Angeles as we help them secure safe street infrastructure like speed humps, curb ramps, crosswalks, things that might seem very simple but are incredibly difficult to secure in Los Angeles, especially if you come from a community of color or immigrant communities. So yeah, with that, I think we have a really great panel of speakers today. They all come from very different backgrounds. I think you'll notice that a theme that goes along through with them as well. But just to give you a little bit of the process, we have 4 speakers. We'll go through each speaker one by one, and after each presenter, I'll have like a follow-up question, and then move on to the next presenter. And at the conclusion, we'll sort of open it up to you all to ask any questions. So feel free to jot down notes, and feel free to put it also in the chat box too as we move forward. I think we have someone from the SCAG team moderating that. So yeah, with that, why don't we just jump right in? I'm gonna introduce our first speaker. It's Mr. Jake Nelson. He's the Director of Traffic Safety and Research at AAA. As an epidemiologist, Jake considers traffic injuries and deaths as an overlooked public health threat to Americans. And as the association's chief safety expert, Jake regularly works with transportation stakeholder groups, public health practitioners, and elected officials on all levels of government. And I'm really personally excited to have an epidemiologist talk on these issues. I think the intersection of public health and street safety and traffic is it's really closer than most people think. And so I'm really glad we have someone from the public health perspective speak on this. So with that, I'm gonna pass it to you, Jake.
Thank you so much, John. Hello, everyone. Thanks for joining today. As you heard from John, I am an epidemiologist by training, in fact, an infectious disease epidemiologist. And before I came to AAA, I ran a health department just outside Chicago, a place called Oak Park. And I did that during the H1N1 influenza pandemic. So this is my second pass at this. And for the last several months of the pandemic, I've been doubling as AAA's chief safety expert and also as our chief infectious disease epidemiologist, monitoring and curating guidance from the CDC as it applies to our business operations across the country. So glad to be here, happy to talk about this topic, super important. So I'm going to stay fairly high level and just give you some broad strokes of what we're seeing in the crash data. For those of you who ever look at data interact with data from the National Highway Traffic Safety Administration, then you'll be familiar with a database called FARS. It's the Fatality Analysis Reporting System. And so this is data collected from all 50 states that looks at crashes where one or more fatalities occurred within 30 days of the crash. And these are the data that the federal government reports on relative to the overall number of traffic crashes, injuries, deaths, and contributing factors, whether it be alcohol, speeding, non-use of safety belts, distracted driving, et cetera. Every year, NHTSA, there's a little bit of a lag in the data that they collect before they'll report it nationally. Even like whether it's generally or specific to a particular topic like alcohol impaired driving. And every year NHTSA also does an early estimates look at sort of the first half of a particular year, the year prior, as compared to that first portion of the year before that. And they just in October did that for 2019. And so let me actually share my slides here. I failed to do that from the beginning. I apologize. Here we go. So again, every year they put out their early estimates on the FARS data. And here is a snapshot of what we learned from that report. So the first 6 months of last year of this year compared to the first 6 months of last year, the raw number of traffic deaths went down about 2%. Traffic volume dropped significantly by 16.6%. That's over 264 billion miles of travel that did not occur this year that did last year. And what's really interesting is if you look at the traffic fatality rate, so this is how many people die per 100 million vehicle miles traveled, we see that rate actually went up from 1.06 to 1.25 for that period of time. Now, one of the things that everyone wants to know is what are the contributing factors to this trend that we see here? And no surprise, NHTSA says it's too soon to tell, but that they'll look into it. And so this is super common from any federal agency, CDC, NHTSA, Federal Highway, it doesn't matter. They need to have the facts to back up the statistics that they're going to share publicly, and that makes good sense. But I'm happy to share a little bit about my perspectives on why we might be seeing some of the trends that I just shared with you. And so I'm going to run through a couple of those with you now. So the most obvious is stress and anxiety. And this is stress and anxiety related to just public health fears about getting sick or loved ones, friends and family getting sick with COVID-19. Obviously, huge economic stressors in all of our lives right now relative to job loss and other factors. And for those who are suffering from substance abuse problems or illness, the inability during at least a portion of the pandemic to seek treatment and to receive that treatment for their illness, or those suffering from domestic abuse, the ability to get out of their homes, all contribute in a variety of ways to stress and anxiety, which can play out on our roadways when we get behind the wheel. And we'll talk more about that in just a moment. Obviously, increased free time. I'm the father of 2 9-year-old girls, and I know that they're not driving and contributing to the trends that I shared with you, but when they have lots of free time is when they get into trouble. And unfortunately, I don't think that being an adult changes that all too much, especially if alcohol and other drugs are involved. So we'll talk more about that in just a moment as well. Nielsen's market data and many other outlets, in fact, have reported on total alcohol sales during the pandemic. And so if you were to look at just alcohol sales outside of bars and restaurants, what we were able to see during the pandemic is about a 24% surge in consumption of alcohol alone outside of bars and restaurants. A variety of sources also have reported on consumption of drugs other than alcohol, and probably the most common would be marijuana, and saw a 20% surge in consumption of cannabis during the first part of the pandemic. And in a lot of that research, they asked for reasons why. And in every case, the winner was stress, anxiety, and isolation. So interesting finding there as well. Now, you've probably also seen media headlines that talk a little bit about a dramatic spike in overdose-related deaths. And so this is obviously a much bigger issue than a highway safety issue for sure. But if any of you who are joining us today know anything about drug abuse or misuse, then you would know that for opiates and opioids in particular, when users will consume their dose when they finally get it, it's immediately. And if you're traveling to get your dose, those individuals most likely will consume it when they get back to their car before their ride home. And so this obviously creates a substance impaired driving problem that may have contributed to the increase in the fatality rate during the first part of the pandemic. One of the last contributing factors that I'll highlight here, this is a headline from Michigan Outlet out of the University of Michigan, talking about Michigan police relaxing enforcement of different kinds of traffic safety laws. And at the time, this was for good reason. This article is dated, it looks like April 6th. And so obviously we knew a lot less about COVID-19 and the way it was contracted and spread at that time as compared to today. And I think a well-intentioned policy trying to reduce opportunities for close contact between law enforcement officers and those traveling on our highways was to not stop people if it could be avoided, unless the infraction was super egregious. And I know it's all relative, but as a highway safety professional, I have to say that in my view, speeding is egregious. And as we all know, contributes to about 1/3 of all the fatalities that happen on our road. And this wasn't just localized to Michigan. The International Association of Chiefs of Police, about the same time, issued guidance to law enforcement agencies throughout North America to do just exactly what was done here in my home state of Michigan. And so police officers weren't enforcing traffic laws, at least then, the way that they do traditionally outside of a COVID-19 pandemic situation. And so one of the sort of the implications of all of this might be potential policy considerations. And so I wanted to just go over a few of the ideas that came to mind for me. And this is applicable, I think, now and in the months ahead. As somebody who's been tracking this pandemic very closely and looking at community spread throughout North America on a weekly basis, I can say with absolute confidence that it'll be this time next year before we live our lives the way that we did relative to social distancing and mask use and those kinds of things before this pandemic. And so the pandemic, even though we have this great announcement from Pfizer with a vaccine that has an efficacy rate of at around 90%, which is fantastic and pretty unheard of in the generation of new vaccines for any communicable disease. So that's good news, but there are massive manufacturing and distribution challenges ahead of us relative to that vaccine. And so even when it does become available and it's approved by the FDA as safe to use, it'll be limited to frontline healthcare workers and to the most vulnerable people as it relates to COVID-19. So people with underlying health conditions, the elderly, those kinds of folks. And it won't be until we're well into 2021 that any vaccine, whether it's Pfizer's or from any other manufacturer, becomes available in a widespread way, the way that the flu virus is today. So these are things that are relevant for the data in the last 6 months in the past, but I think are going to be relevant for the next year ahead as well. And so an obvious one is automated enforcement. If we're approaching the darkest days of this pandemic in the next 60 days, which we are, I think that we're going to have to be more creative in taking advantage of automated enforcement practices. And we can't do this hastily, these programs are not implemented the same everywhere, and they need to be done well, they need to be done right, and they need to be data driven. Alcohol ignition interlocks, huge way to separate drinking from driving, at least while the device is installed. And I know that you all are familiar with that technology. Screening and brief intervention, that's what SBI stands for. Not everyone who is an impaired driver, whether it's drugs, alcohol, or a combination, will benefit from treatment. But there are ways to identify and triage people who are, and getting them into treatment, I think, is really important. And we do a really terrible job in this country at educating consumers in a way that actually impacts their behavior. And so there are some really great resources. AAA just in December published some really great work about how to develop impactful, meaningful, and effective consumer behavior change campaigns. And those can be found on the AAA Foundation's website. So I would encourage whether you're a federal, state, or local organization or agency to take advantage of some resources to help the limited dollars we have in highway safety impact highway safety in the right direction to the extent that we can. So John, I'm gonna stop there, and I'm happy to take any questions from you.
Yeah, no, great, Jake. Thank you. I think we have just a few minutes. So real quick, you listed some great points about factors like anxiety, free time, alcohol and drugs, lack of enforcement or lax enforcement. I feel like a lot of folks on this call could probably relate to a lot of these factors and these conditions. And a lot of them are linked to the pandemic. So my question to you is, you're speaking in terms of maybe the next year or so, but longer term wise, when the pandemic does calm down, do you think things will just snap right back, or do you think this will leave more of a long-term impact on how we drive and what our street safety looks like?
That's a good question. And obviously, as much as I would like to, I can't predict the future. But I do think that I can say with a good degree of confidence that I don't think we're going to go back to normal. I don't think that we'll see the trends, after this this particular pandemic is behind us. I don't think we'll see the same trends then that we see now. But I do think that there will be some lasting effects of the pandemic that are relevant to the work that we all do together. And, one good example of that would be the impact that it's had on the way that we all work within organizations. And there's a huge trend right now across the United States and other developed nations to move to more of a hybrid model where people are working from a home office and working from inside traditional office buildings as well. And so that's going to impact traffic volumes in ways that we maybe have grown accustomed to during the pandemic, but certainly that we didn't see before the pandemic. And so I think that will be a lasting effect. I also think that there are going to be some impacts relative to that might impact modal shift, right? And so I don't know how many of you use public transit, but I'm based out of Washington, D.C., and my very few encounters with transit and my colleagues who also rely on the public transportation system there, hardly anyone is using them. And I know that that's not possible for everybody who might have to rely on it to go to work and to provide for their families. But if people are less inclined to use public transit, that can influence modal shift in all kinds of ways. It could influence the proportion of people who are walking and biking who maybe weren't before because they just feel safer doing so from a public health risk point of view. The use of different micromobility options, I think, will be impacted, and obviously personal comfort in using ride sharing services and taxis, I think, will change as a result of this pandemic for a while after, even if we can legitimately say that COVID-19 is behind us.
No, great, thank you. I mean, all the things you just stated, I see things changing like that, whether it's our buses, micromobility, even here in LA happening now. So yeah, it'd be kind of crazy to see what's going to look like in the next 5 years to come. So thank you, Jake. I appreciate your presentation.
Thank you.
All right, we're going to move. Oh, thank you. We're going to move on to our second presenter. It's Dr. Ofer Grembeck. He is the co-director of Safe Transportation Research and Education Center, or also known as SafeTrack. SafeTrack is a research center affiliated with the UC Berkeley of Public Health and the UC Berkeley Institute of Transportation and Studies. So you may be seeing a similar trend here, right? Public health and transportation, public health and traffic. As a principal investigator, Dr. Grembeck has obtained multiple sponsored research awards to study pedestrian and bicycle safety issues and safety management. Some other topics of research include injury risk in multimodal environments, pedestrian safety, which is close to my heart, systemic approach to road safety management, and in-vehicle injury protection systems. And so with that, I'm going to pass it to you, Doctor. Oh, Doctor, I think you might be on mute.
Yeah, figured it out. Sorry. Great. Can you hear me now and see my slides?
Yeah, you're good.
We see your slides, but they're not full screen.
Oh. So, hold on.
I think F5 might pop it up.
Yes. How about now? Same?
Either or maybe at the very top left, play from start. That should give you a full screen.
Oh, it says sharing is paused. Bring your shared window to the front. Maybe I'll stop share and then reshare.
Yeah, that might be it.
Sorry, it worked fine before when we tried it. What now? Same thing?
Yes, perfect.
Oh, now it's good?
Yeah.
Great. Okay. So sorry, everyone. Let me. Okay, now it's already. So hi, everyone. Sorry for the technical difficulties, and thank you, John, for the introduction. So I'm going to be talking about some intermediate findings based on work that we are doing to better understand the impact of COVID-19 on traffic safety on California highways. I will be giving the presentation, but this is, of course, joint work with our team at the UC Berkeley Safe Transportation Research and Education Center. So I'm going to dive right in and start by identifying what are two possible impacts of a pandemic on traffic safety. And the first one is the impact on exposure, which basically means that the level of activity as a result of the stay-at-home orders in California, as a result of that, there was a major drop in traffic, similar to what Jake described as happening nationwide. And less traffic means less exposure and potentially a reduction in the number of crashes. The second impact is on operations. And this includes both the perspective of an individual road user who might behave a bit differently and again, similar to what Jake described in terms of anxiety and in terms of other things that are happening, but also from the perspective of how the roads are operated. For example, much less congestion being, that's an example, the roads are now operated a little bit differently. So we're seeing behavioral changes and the roads by themselves have a different level of congestion. Either way, these operational changes are likely to trigger a behavioral response. And then a third point is that, and that's an important point, is that now that things are changing at a rate that's much rapid, much faster than what we used to before. So it requires us to monitor things at a higher frequency, and it's something that's new to us. So some of the findings that I'm sharing here are actually, they're all intermediate, but every week, every few weeks, we kind of try to update it and we try to see if there is more information that we can obtain to better understand what is happening and how can it be addressed. So what we did, we created a weekly injury crash dashboard. We update it on a daily or weekly basis and provide options to see the data across the state, the state as a whole. And then we have smaller tables that aggregate 6 Bay Area counties and 5 Southern California counties. So you can also look at that in a slightly more regional perspective. Now, the data is coming from 2 different sources. The first is police reported injury crashes, and these are crashes that are added to the California statewide integrated traffic record systems, for short, SWITRs, and that's entered by the California Highway Patrol. Now with this data, there is a delay related to submitting, processing, and tabulating the crash data into SWITRs. And this delay makes the data too restrictive for crashes that occur on non-state roads to be included here. So the data here includes only highway crashes. In addition to that, because there is a delay, we always have to be more cautious about data from recent weeks. And recent we're seeing can be even as much as 3 or 4 months. So the data that's more recent, we're looking at that with kind of a lower level of confidence. But data that's 4, 5, 6 months ago, we have a higher level of confidence that it is accurate. So as I said, the scope of this is the state highway system, much more because of the data limitations, but we intend, as things continue to progress, to also do the same analysis on non-state highways. And we know that's a very interesting part that we want to take a look at. The second piece of data is the exposure data, and that's based on vehicle miles traveled. And that's provided by the Caltrans Performance Measurement Systems, for short, PAMS. It is limited by loop detectors, but does not suffer from a reporting lag. So we know that the data is always current and represents the level of activity, again, on the state highway. So that's how we constructed this weekly injury crash dashboard. It's on our website. It includes data about different crash severity. So you can see total crashes, fatal plus severe crashes, and VMT. And we're also including the same data for 2019. And then the last 3 columns are percentage changes for total crashes, fatal and severe crashes, and VMT. As you can see, the last column represents the change in VMT percentage relative to the year before. And you can see that in the earlier weeks of shelter in place, the VMT dropped by about 30 to 40%, very big drops. And then it's not included on the slide here, but right now it is still lower. It has bounced back, but still lower. Right now it's at the levels of about 10 to 15% lower than what it was before. And one of our goals here was to check whether the drop in VMT converted to actual safety benefits. So we conducted naive before-after comparison, and we compared 2 things. We wanted to look at the number of crashes, has the overall number of crashes, how did that change? And we also, as we do in traffic safety, we were very interested to see the rates. And because we have the crashes and we have the VMT, we're able to calculate the crash rate across different levels of injury. And once we started looking at the data, we saw that there is a bifurcation of the impact. And that caught our attention as something that, when you think about it, should have been expected, but we found that interesting. So when we look at minor injury crashes, and what we're calling here minor injury crashes are actually 2 types of crashes. One is complaint of pain, and that's the lowest level of injury crash. And the second is minor. So we're kind of combining them here together. These are the 2 lowest levels of injury crashes. And we're seeing, when we look at the number of injury crashes, minor injury crashes, we're seeing a very big drop from an average of over 1,000 in the pre-COVID days to about half, to an average of about 500 per week in the after period. And this is a huge reduction of about 50% in minor injury crashes. When we look at the minor injury crash rate, we saw that there's also a big increase in the crash rate. And in this case, the reduction is about almost 30% in the minor injury crash rate. So it means that per unit of VMT, we're seeing fewer minor injury crashes. When, to kind of lay it out visually, what we have here 3 points in time. The first one with an average of 37.48, and that represents the minor injury crash rate for the before period. I kind of have these ovals here because the data is a summary of 6 weeks. So these are the first 6 weeks. We then excluded the week of March, mid-March, because that was a transitional week. And then we did the same thing for 2 follow-up periods. If you can see, they're like little error bars above each of these dots and averages. And what that tries to capture is the fact that as we progress in time, this is all provisional data, so more data can flow in, and we're seeing that these numbers can change a little bit. However, because it's much more typical that more crashes are included as opposed to removing crashes, it's going to be much more one-sided. So we know the values that we see there are more of a lower bound. And for the weeks that are, for the durations that are earlier, you can see there's a very small error bar. But as we move to June, we see that the error bar is bigger, which means that number can still go up. But if we look at the before period and the first after period, we see this big drop in minor injury crash rates. And then the story changes a little bit when we started looking at fatal and severe. As Jake said, and we saw the same thing in California, there is a reduction in the overall number of fatal and severe crashes nationwide and also in California. And that's definitely a good thing. But when we looked at the fatal and severe crash rate, labeled here as per 100 million VMT, we saw that the fatal and severe crash rate actually went up. And again, this is aligned with the trend that is seeing nationally in the numbers that Jake reported from NHTSA. So, so it's not, so there's no surprise here. But the part that we're finding interesting and important to talk about is the fact that we're seeing slightly different patterns based on different level of severity, and they were all exposed to the same circumstances. Minor crashes and fatal and severe crashes were all exposed to the same changing circumstances, and one type of crash went down by a lot, and the other type of crash rate went up. And this is again the same. This is the data with the error bars for the fatal and severe. And as you can see, it went up from about 4.4 per 100 million VMT to by about 17% to 5. And then if we move one more after period, we can see that it is slightly lower than it is in the first after period, but the error bars would still allow it to grow. So it's probably still just a lower bound. So what does this mean? First, this major reduction in minor injury crashes is a good thing. It means we're seeing less minor injury crashes. On the other hand, we're seeing an increase in fatal and severe crash rates, and that's a concern. Similar to NHTSA, we still don't have a kind of definite answer on what is the cause, what is the mechanism, what is happening there. But we're kind of all the time trying to analyze the data so we're able to make some more concrete conclusions about why has it gone up. But the takeaway from these findings is that maybe even go beyond the pandemic, because basically means that reducing minor injury crashes does not necessarily mean that the reduction in fatal and severe will follow. And this is very well aligned with Vision Zero approach and safe system approach, that you actually want to focus on the most important crashes, the catastrophic ones. So the takeaway from this is that we have now evidence that not all crashes are the same. The idea of the crash pyramid, where the bottom is very minor crashes, and as you go up, it becomes more and more severe, and the top is fatal crashes. But the idea holds when we're looking at a specific crash type, but it starts to fall apart if the causal mechanism of many of the minor crashes is different than the catastrophic one. So what we think might be happening here is that many of the minor injury crashes on highways are probably congestion related, and these are more back of queue fender benders. And because there's a lot less congestion, we're seeing a lot less of these. But then the fatal and severe crashes are more free flow open road crashes, and we're seeing an increase in that. So if we want to reduce fatal and severe crashes, we need to make sure that we're looking at the pertinent data when allocating these resources. So that means that even beyond the pandemic, we need to make sure that we're using the correct data for life-saving resources. Thank you.
Thank you, Dr. Grembeck. For those who haven't checked out SafeTruck's website, they have a traffic injury mapping service, and I recommend you all taking a look at it. You can actually get like a block by block view of your neighborhood and see how much crashes have happened over the years. And so definitely take a look at it. Thank you, Doctor. You know, as a part of a moderator, one of my responsibilities is to make sure we're moving on good time. And so I'm going to actually skip the questions and move to the next speaker. But Dr. Grembeck, I'm sure there'll be an opportunity for you to answer questions at the end. So thank you. The next speaker we have is Dr. Misha Young. He's the postdoctorate researcher at Three Revolutions Future Mobility Program. That is at the University of California, Davis Institute of Transportation Studies. His research focuses on emerging transportation services and the future of personal mobility. So I think we're shifting a little bit on our topics, going from public health now to looking at some new mobility options we're seeing now. So the doctor has worked, his work has centered on the impacts of ride-hailing services to inform regulatory decisions and to ensure they improve rather than hinder societal outcomes. And he is an avid cyclist and an urban tree enthusiast. So let's all welcome Dr. Young.
Thank you, John, for the deep dive introduction there. So yeah, my name is Misha Young. I'm a postdoctoral researcher at the University of California, Davis. And today's presentation will be on travel mode and behavior changes during the COVID-19 pandemic. So the advantage of being third in the list of speakers is that much of my introductional slides have already been mentioned. There's been big disruptions caused by the COVID-19 pandemic, need for social distancing, impacts on employment, and a huge increase in e-shopping as well. But today, what I'll talk about is the impact on mobility. We've seen how the COVID-19 pandemic is already causing changes in transportation supply. In LA Metro has decreased its supply of buses or of transit by roughly 20%, if I'm not mistaken. And we've seen a similar trend with ride hailing, which faced a cut in ride hailing demand by 60 to 70% in the earlier months of the pandemic, and have responded by suspending all shared ride hailing services like Uber Pool and Lyft Line. So what we decided to do at UC Davis was to start looking at the individual mobility and how the pandemic had affected individuals' travel within cities. To do that, we used a combination of different data sets. We had, I won't go into too much details on these, but the one on the left is a longitudinal data set. So basically recontacting people, respondents who'd already participated in some of our surveys in 2018 and 2019. We also conducted a convenience sample through an online opinion panel, trying to mirror the sociodemographics of people living in 17 US cities and 2 Canadian cities. And then also conducted a convenience sample just to try and touch or to connect with people who were not able to reach through the longitudinal or opinion panel. So that was through various channels, including online social media, Facebook, Instagram, and professional listservs as well. And these surveys covered a broad range of topics, looking at what were these the household structure before and after the pandemic, employment status, e-shopping, and of importance of today, also transportation characteristics, whether their travel behaviors and travel choices changed because of COVID-19. So what we'll look at is the impact of the pandemic on travel behavior. And to understand travel behavior, the first step is to look at travel patterns. So what we did is we asked people in our opinion panel, the question was, in an average week before COVID-19, so before March 2020, how many days per week would you physically travel to work? And we see that about 68%, 2/3 of people would commute 5 days or more to work would actually physically travel to work. Whereas asking the same question during the pandemic, so the survey was asked during May to July, that number fell to under a quarter, so 23.9. So a lot more people were working from home and were not commuting 5 days or more per week. Another way of looking at this is looking at the proportion of people who telecommute. And no surprise here, before this was looking at the longitudinal data. So asking people in 2018 and in 2019, 64% of respondents would not, 0 days they'd telecommute. So they'd go to work every day, the 5 days a week, and they would not work from home any days. And then during the pandemic, we saw that number fall with a much higher adoption of telework. Only 24% of respondents continue to not work from home. So what we wanted to do then is to try and dig a little deeper and see who within society, based on sociodemographic characteristics, were the ones working from home and who were the ones still going to work. And what we found was that income had a significant effect. So this is the proportion here of people who were able to work from home. We see that before the pandemic, high income people had a large proportion of people who would not work from home, and that switched to most of them being able to work from home 5 days a week. And we see the proportion of people still not being able to telework increase as income decreases. So low income people are the ones who have jobs who are the most, who are not able to work from home. They have to go into work regardless of the pandemic or not. So this was interesting and important when looking at the effect of commuting, for instance, and of transit. If we start reducing transit supply, who is it really affecting? Is the ones who depend heavily on transit, the low income people who still need to go into work. And then turning to, we were looking at ridership of different travel modes. We asked the question, how does the pandemic change people's bus usage or transit usage? And found that roughly a third, or 36.7% of respondents, indicated that they use the bus less since the beginning of the pandemic. And of this third of these 36.7% of people who use the bus less, a third of them use the car more. So they're substituting away from transit towards driving as one of the travel behaviors that we're seeing. And then just to make sure that we weren't seeing that trend in reverse as well, we asked the question of, are people driving more or less because of the pandemic? And found that people are driving, of course, less because a lot of them are working from home, but that the people who are not driving as much are not using transit instead. The percentage of people who are driving less are doing so because they're teleworking, they're working from home, they're not switching over to other modes like transit to the same extent. And that points towards a hesitance towards using shared services like transit. To get to the bottom of that, we started asking attitudinal questions as well in our survey. So I won't go through each of these, but I'll start with the first one. So the question was, I will travel more by car because I feel it makes me feel safer from the transmission of pathogens like the COVID-19. And over 30% said they somewhat agreed with this statement, and another 28, roughly 30% again, strongly agreed. So there's a lot more people in the earlier months of the pandemic who indicated that they were willing to switch towards driving more because they didn't feel safe using shared services. This was compounded by the other attitudinal question that we asked with regards to ride hailing, which was, I will use ride hailing services as often as I did before the pandemic. And many people strongly disagreed with this statement, saying that they would likely use it much less because there is a hesitance towards using shared services. And the bottom two here was more looking at active modes. So active transportation modes were often seen as a way, if we see this increase in driving and we want to reduce congestion, we should also promote active modes of travel, because those are often modes that are not shared. So people may feel not as concerned trying these new modes. But when we asked them whether they would use their bike if we provided more protected infrastructure, protected them from car traffic, many people still did not say that they would use cycling, which gets to the bottom. Perhaps there's a deeper problem. It's not just safety, but it's also land use, and people don't see cycling as a feasible or useful mode given where they live and where they work. And then we also had concerns regarding people were saying that they were uncomfortable putting their hands on the handlebars of shared e-bikes, e-scooters, or e-mopeds that people had recently used. So that's something to consider if we want to promote micro-mobility, is how to make these modes safer, or at least the impression of them is safer, to make people comfortable using these travel modes. A bit of policy recommendations and things to consider here. So at least for the time being, travelers remain hesitant towards using shared modes. We saw that with a decrease in transit. We saw that with ride hailing, putting on pause or pretty much canceling for the time being all their shared services. There's also concern that if we start reducing the supply of transit because of funding issues, because there's not enough demand, the people who will be impacted the most by that are the ones who depend on transit, which, as we've seen, are low-income people who still need to go into work. And there's also space for policymaking, in particular to promote active modes. So we've seen the resurgence of car travel, especially lately. People are going back to their cars because they don't feel comfortable using shared services like transit, like ride hailing. So one of the ways that policymakers can reduce this congestion is to promote promote active modes of traveling, like cycling, like walking. More infrastructure would be a good solution as well. It's always important to keep the equity impacts and keep that in the back of our minds. A lot of low-income people were the ones who are most likely to have lost their jobs during the pandemic, and the ones who did keep their jobs are most likely the ones who have to keep coming into work. So who depend on transit, for instance, if they don't own a car, if they see a decrease in transit supply, they're the ones who are going to be the most affected by this decrease. So this is an ongoing research project. We currently have a few papers right now in the works that are out submitted to academic journals. There's also, we have the intention, we're currently working with the SCAG region right now to have a fall 2020 edition of the COVID-19 mobility survey. So what the prior survey enabled us to know was the short-term impacts. We conducted it in May to July. So we have a good idea of what the short-term impacts of the pandemic are on mobility, but we want to determine what are the long-term implications. Are people still not traveling to work? And if not, are they looking into buying either a bike, a new car? What are the new travel behavior patterns that we see due to the long-term impacts of the pandemic? So I'll keep it short. I do want to thank my research team. These are other researchers who have helped with this research project and this survey. I also want to thank our sponsors who have made this project possible. And lastly, if you want to learn more about this research project, about the, we have our data collection, policy briefs, reports, you can go on our website, postcovid19mobility.ucdavis.edu, and you'll find the up-to-date, all the newest information with regards to our research plans and our publications as well. So I'll leave it there on this note. If you have any questions, I'll be glad to answer them as well.
Thank you, Dr. Young. Actually, we have a few seconds, so I want to ask you just one quick question. I think you're painting a predicament that a lot of cities are facing, especially with budget crises, cutting services. You know, LA Metro just recently cut bus services by 20%. Just real quickly, are there any cities that are doing it right? I mean, you have some really great policy recommendations. So real quickly, your answer could be no, but are there any cities you can name right now you think are doing it right?
Yeah, there's many cities who have seized this opportunity to try and pilot new ideas. One of them that comes to mind is the city of Paris right now in Europe, which during the last 6 months has just approved over 650 kilometers of bike lanes. So they're trying new things that would not have been possible were it not for the pandemic to encourage active modes of travel. And they're seeing pretty successful results. A lot of people are starting to cycle. and the rate of congestion in the city has decreased substantially as well.
Got it. Thank you, Dr. Young. All right, we're going to move on to our final speaker. We're going to shift now into more about community and policy, something that's dear to me. The next speaker is Mr. Brian Ulashevsky. He's the executive director at City of Fabric. He has over 2 decades of experience working in the design and planning field on work spanning tactical interventions like pop-up plazas and parklets, to building and landscape projects, to regional scale planning and state policy. You know, as a community organizer, stuff like pop-up plazas, parklets, really these kind of tactical interventions are incredibly powerful, especially when you want to build public support. So I'm really happy that we have someone to speak on this. He also teaches within the Landscape Architecture and Urbanism Department at the University of Southern California School of Architecture. Brian is recognized as a leader in city building and has been recognized by the American Planning Association's LA chapter with the John Chase Visionary Award, and has been invited to speak at several academic and industry publications. So with that, I'm going to pass to you, Brian. You may be on mute.
Bingo. Thank you, John, for the introduction, and I'm honored to be part of this panel. Really great information being shared here. I'm going to be taking those presentations and making notes for our future work. So thank you all. My name is Brian Ulashevsky. I'm part of City Fabric. We're a nonprofit urban design studio based out of Long Beach, but we have quite a bit of work across Southern California, working with local government, agencies, other nonprofits, and community partners to enhance and reshape communities of need through collaborative design and planning. And so that's all to say, that we do a lot of different things, and we try to fill a lot of different roles, and both as advocates, as partners, and as consultants. And we've obviously seen a massive shift over the past 9 months, how our work impacts communities, and how important our work is, and how quickly we can deploy. And so I bring that up because this is a project where we're reshaping the sort of public realm for community health and safety and wellness. And this was once an intersection, most dangerous intersection in the city. And we worked with the city, public works, traffic, transportation to reimagine the space, and the community to reimagine the space into a park itself for a very park poor community. I say that, and it was a great project, a lot of support, a lot of resources leverage, but it took nearly 10 years to actually execute this as a project, because it was so complex, requiring transportation, requiring parks and rec, requiring outsourced various funding sources, both at the federal and state level around transportation and parks. And so we have to move faster. And so, we've always worked around community health as far as when it comes to housing, comes to parks, equity, transportation, economic development. And we had been working with the health department of Long Beach and various other departments to develop a pedestrian plan for the central portion of Long Beach. And it was a very different approach to transportation planning, in that the lead agency was our local health department. All the other departments were involved, planning, public works, transportation, but this was something that was very much driven by health. While we still had considerations around first and last mile, we had an additional focus on access to healthy choices as in healthy food, schools, parks, and it took a different lens because also it was a focus on equity, because a lot of the health indicators that we were looking at aligned with historic racism, systemic economic lack of economic inclusion. And when you look at whether it's environmental impacts or Vision Zero and safety considerations, health indicators, economic impacts, there's a very significant alignment that we're seeing where those communities are continuing to struggle. And actually, even today, you're seeing that today with COVID, in that you could even base it back into the days of redlining, where financing mechanisms were not available for communities of color and impoverished communities. And you see these lasting impacts in health outcomes and economic inclusion, and even today with COVID. And so you're looking at a map of Long Beach, and the darker areas are the zip codes with higher rates of infection. And these are the same communities that are unequally impacted by environmental justice issues and air quality, lack of park space, and public health indicators around asthma and obesity and other chronic illnesses. And so we have to address it today, and we have to address it rapidly as part of the pandemic, but these are systemic issues that are not going away, and so we have to have longer lasting impacts. So, you know, what works today, we need to continue working on tomorrow. And so what we've been looking at are different ways to adapt our environment quickly, rapidly, employing some of the things that we've learned in the past around tactical urbanism, parklets and plazas and temporary plazas. And so we've been leveraging the public realm in different ways, taking advantage of reduced traffic, VMT and traffic volumes, and really sort of a great sense of urgency, both around public health, but also our local economic health. And so what we've been doing is working with the city. They have an open streets program where they've been rolling out a large quantity of temporary parklets. And so parklets are basically, for those who, just to make everybody aware, are basically capturing a portion of the street, whether it's dedicated to parking or travel lanes or what have you, and repurposing them for pedestrian uses or community or social spaces. Parklets have included outdoor dining. They include public open space like parks. Obviously, they're not very large, but we have had to be creative and take advantage of these spaces because of various restrictions on the use of internal spaces around commerce. And so you saw basically in Southern California around the 4th of July weekend, when the order came that we basically had to have all businesses shift to outdoors or even close for the time being, the parklets just started popping up everywhere. And really strong compliments to the city's agencies that were involved with that, because they deployed over 100 of those within very short order. Now what we're looking at is how do we also adapt the environment for other means, whether it's completely closing streets. This down in the lower left corner is Pine Avenue, which is kind of the main street of downtown Long Beach that was actually closed for multiple blocks so that restaurants and businesses can have their business outdoors. The middle lower picture is an alley and another neighborhood shopping district that had very little use, and we basically worked with the business association to close it, activate it. It's a really nice space. It's amazing what you can do with a few string lights and some potted plants. And then we're also working with the city and a local business association to actually shift traffic over a lane for a whole block, actually for multiple blocks, to expand the sidewalk. It is a notoriously narrow sidewalk, and because of the sidewalk conditions, there's actually quite a bit of issues around accessibility because of the cross slope. And so shifting the parking over a lane and then capturing that area for everything from hair salons to dining to queuing. There's a noteworthy roller skate shop that when they release new merchandise, there's lines out the door 200 deep. And this space is essential for some of these businesses, especially going into the Christmas season, providing areas to queue and distance each other while a few people are allowed in their businesses. And then we've also been surveying community members to follow up with that pedestrian plan that we had done with the health department, to see how people's behaviors have been shifting and what their concerns are and what they're doing today. And what we are seeing is a pretty significant increase in the amount of walking, and walking both for utility, going to the local grocer or to work, but also for recreation and physical activity. And so a lot of people are just walking They're just saying they're walking for the sake of walking because, you know, if you're working remotely, you tend to be indoors all day, and just the ability to stretch your legs is important. But there are concerns that you were seeing in the previous presentations around safety, you know, the severity of collisions. We don't have our local data yet, but we do have much anecdotal information related to fatalities and collisions that are driven by speed. And you know, we're trying to address those things both today, but also in the long term, because some of those same, you know, hotspots were hotspots before. And so what we do see with this sort of tactical urbanism and temporary approach to changing our physical environment to support people is there's an increased willingness to try new things. And even in the temporary parklet off to the lower right corner, that's another commercial district in Long Beach that they tried to actually put a parklet in. A restaurant had tried to put a parklet in probably about 5 years ago and was chased out of town nearly. And but as soon as the order came that we could do outdoor dining, that same area has over 30 parklets. And the question will be now, as we start hopefully transitioning to a new future, you know, what happens to those parklets? Do they become permanent, or is there somewhere middle ground? Because I think you're going to see that there's so many restaurants, so many businesses that have, and so many communities that have found value, rediscovered value in the outdoors. This is Southern California. We've got sunshine, you know, all but like 10 days out of the year. Of course, we're a bit wimpy when it comes to the temperature right now, and the heaters are being broken out, but I think we're going to take advantage. This is something that we're going to be taking advantage of going into the future. And I think all of this experimentation shows that there is an ability to make change without negative impacts, or we can adapt and mitigate those potential negative impacts. And so the last thing I was going to share was, you know, back to what we were talking about with the sort of overlay of, you know, the COVID crisis and the severity in the communities, to economic inclusion, to environmental impacts, to long-term public health impacts and indicators. This is a map of the city of Long Beach and their park distribution. And it's the same thing with density and overcrowding with lack of park space. And so we're even looking at how can we connect now and in the future communities to our park assets so that they can have those recreational activities, and we can start thinking about even those 15-minute communities that everything that you need in your daily life is walkable. So I'll leave it at that. Thank you for having me. I really appreciate it.
Thank you, Brian. We have about a minute left, so I want to ask you a quick question, if that's okay. You know, I think you're pointing out just really great how we can leverage, in a weird way to say, like how we can take advantage of the pandemic to really rethink our public space and use the public momentum that's sort of reimagining as well. So I think it's really great. My question is, in this work, have you changed, or did you have to change any strategies when it came to community engagement before the pandemic versus now? You know, especially with people having to rely on the digital space more. Are there any shifting strategies that you saw in your work?
Yeah, it's obviously been a bit more difficult to do outreach with communities, having to do things virtual or through other means. You know, obviously this is a perfect example. This panel would have been in a conference room with seats, and we're all on Zoom. But you know, so we're having to adapt that, and there is a digital divide that we continue to struggle with when we're trying to engage our community stakeholders, those who are most in need, and you know, most need to be at the table. And so, you know, having to surmount the digital divide is important. But one of the benefits we have seen about sort of this sort of online engagement and remote engagement is that the barrier to participation on people's time is less. We would have community meetings related to affordable housing or transportation and park space, is that the need for, you know, clearing your calendar and having a babysitter is no longer needed. Like, you can have it in the background and be participating. So if we can address that digital divide, I think we're much more able to engage people on their terms, because we're going to their table. We're not asking them to come to ours. And you know, we've tried to adapt to other things, taking advantage of the things that are still taking place. And we've set up questionnaires and surveys and ballot boxes in grocery stores and local businesses. And so that's a way that we've been trying to engage. But it's certainly been, it's been tough. It's been tough to get to the people that we really need to be getting to.
Thank you, Brian. I feel you as a community organizer myself. It's difficult to really do organizing work in this kind of world and environment. So totally. All right, well, let's all give a rather live or virtual round of applause for our four speakers. Thank you all so much for coming in, sharing your information, and being open to questions. So right now, we're going to move on to a moderated panel discussion. I just have a few questions on my end, but I know some participants here may have questions on your end as well. So as was shared by someone on SCAC, please make sure to just type in the questions in the chat box, and we'll take it from there. So my first question is actually for the data folks. And I know, Dr. Grembeck, I know you didn't have an opportunity to answer questions, so you feel free to take a stab at this if you'd like. But I think something that I've heard from two panelists actually is the difficulty of having responsive real-time data, and then there's a delay to it. So is there a way to get around this? Is there a solution to this? Is it just more resources, or is it just refiguring out how to do this kind of research? We'd just love to get your thoughts on that, because it seems like to be very important, especially during the pandemic.
I can try to begin. Thank you, John. I think that there is a solution, and I think that a lot of the mechanisms of reporting crashes are there, and it's more an emphasis on needing it to be timely that is happening now that we did not have that urgency before. So I think many local agencies are operating in a manner that would facilitate traffic safety analysis for previous years. And it does not require to have necessarily real-time data, and we wait for the data to accumulate so that we can have some statistical confidence. But now I think the message is that the reality of the pandemic is that we need to have the safety data or the crash data come in at a higher frequency or with slower lags, because we actually need to analyze the data not in real time, but as soon as possible. So I think the practices are there, the technology is there, the procedures are there. It's more, there's a need to emphasize that there's an urgency to get that faster rather than slower.
I would just add, I don't disagree with those comments. I think it's probably more realistic at the state and local level than federally. And is a matter of resources and the will of policymakers to make it happen. One thing related to this notion of more real-time data that was a lesson learned, I think, through this pandemic is just the reality that when states went to stay-at-home orders, a lot of research stopped, including the collection of a lot of research data, especially data that involved human subjects, right? And for good reason. But I think for economic reasons, there was a lot of research that didn't necessarily involve human subjects, just required, a database and a computer to do analysis that was temporarily halted just because of the uncertainty around the pandemic, the stay-at-home orders, maybe access to the computer equipment and software that analysts would normally use. So I think that those are all, lessons learned from this past experience. And perhaps if we are unfortunate enough to encounter another pandemic in our lifetimes, we'll remember this and have learned from it, and will have made changes to allow for the continuation of at least some of the research that we deem important relative to highway safety.
Yeah, I'll just quickly build upon what Jake and Offer said here. We're seeing a bigger appetite from municipal governments and states as well of collecting data. So that's been fortunate on our end, whereas we used to only collect our travel surveys every few years, every 5 years even. Now we're doing it twice, even 3 times a year. So we're getting a better picture of the impacts of this. So hopefully that will persist in the years to come as well. And that will really improve our understanding of the pandemic, but also the years after, the recovery time, what that means in terms of travel behavior and purchasing behavior and other aspects of people's lives.
No, I think that's actually a good segue into my next question, which is what's missing? Like, what kind of data do you wish you had more of? Whether is it breakdown of ethnicities, breakdown of gender, or the type of active transportation users versus commuters? Yeah. So, what do you wish you had more of, knowing what you know now?
Misha, were you going to go first?
I'll go for it.
Oh, so I'm going first. Okay. So when we are trying to figure out what are the factors that are causing these crashes, for the most part, in most states, we're limited by coded variables that are coming from the police reports. And those coded variables have kind of matured over decades. And many times we're seeing that it does not quite tell us all of the information that we would need to better understand what happened. This is, of course, true for pedestrian and bicycle crashes, where the amount of coded information is very thin. But it's also true for vehicle crashes. And the challenge is that when things change quickly, the forms will take a decade to change. So, so we don't necessarily have all the information we would need to better understand it. And as an example, there is a code about unsafe speed. And these get coded in situations that it's excessive speeding, but can also be coded in situations that there's congestion and it was unsafe speed for a congested situation. And in a situation like now that we think that there's a difference between unsafe speed in congestion and unsafe speed in free flow, we're seeing the impact is very different and we would want to be able to separate it more. So the answer to some extent is that the information is there, and it's always there in the police officer's narrative. So there's also a written narrative, and typically those don't get entered into a database. And us as researchers would love to have access to those narratives because the truth is there, the story is there. And today we have the ability to analyze such structured narratives that would actually respond with the time, and the things that are relevant would emerge out of there. So that's what we would want, more access to the narratives.
So yeah, quickly adding on that, sorry, was that what we're missing is a lot of data on low-income people. Because of the digital divide, what we're seeing is that a lot of people cannot be reached by either by phone, by internet survey. So we're missing an important piece of the puzzle. Often the people who are the most affected by this pandemic are the ones who are the hardest to reach through surveys. So that's been something that we've been working really hard with opinion panels to oversample these segments of the population, but that we've found difficult throughout this process.
You beat me to it, Misha.
Sorry.
Great, thank you. My next question is, and I usually like asking this question because it's like a frame of reference, but if we were to wind ourselves all the way back to January 2020, before we knew the pandemic was going to happen, right? Before it came to our shores. Since then to now, what would you say is your biggest realization in your field, in your work? Like what is an aha moment you had in your work that's related to our topic today? I'll give you a few seconds to think about it.
I'll say on our end is how quickly things can happen when the urgency is there. I brought up the example of the one project that took nearly a decade to accomplish, versus the city here, and it's in many other communities as well, is that there is an ability to adapt quickly and try things out, and then if it doesn't work, is try it again, try something else. It's like and there's an ability to iterate and get to the right answer. So I would say, yeah, we can be quicker than we are.
I would say that there was a period of time when we were in the early part of the pandemic when there were anecdotal stories about speed and alcohol, impaired driving crashes, and sort of road rage on the road, the things that we've all seen in the media and that now we know a little bit more about. And I think there was a hesitancy to speak out on those topics and the importance of safety on our roads because we were in a pandemic and the concern that it might be insensitive. And it's hard to say if we could go back because we can't, right? And hindsight is always 2020. But I think it was, for me, just the realization that a life is a life, and whether it's somebody who's suffering or who dies of COVID, or somebody who suffers because of an injury in a traffic crash or dies in that traffic crash, it's all important. And if we see emerging trends, I think we have an ethical responsibility as public health and safety practitioners to speak up on those things.
All right. Oh,
Hi.
Dr. Brembeck.
So just very quickly, so for me it's two. One, I can work from home. I never thought I'd be, I'd be possible. It would be possible for me to do that. But then on the professional level, I think that it reiterates the need to focus on the most catastrophic crashes. But it highlights the aha moment is that while the federal government and some states highlight that and want agencies to focus on fatal and severe, it really illustrates the challenge this has for some local agencies where the numbers are just low and it's very hard for them to make effective road safety management practices based just on fatal and severe. So it illustrates the need to have more proactive approaches that you can make the road safer even if you don't have all of the data and before you have a full picture.
Great, thank you. So I actually did a brief look at everyone who kind of put their names in the chat, and I think a lot of folks and participants on this call actually either come from like city government, transit agencies, or some kind of policy or regulatory perspective. And so this is your opportunity. If you were to say one call to action to people in government working with elected officials or transit agencies, what would that one call to action be?
Yeah, I'll quickly start. One thing that kind of touches upon your previous question too, of this aha moment for me, was how, of course, there's definitely winners in this pandemic. You can think of Amazon and all of them, but the other potential winners were policy makers, because it gave them the opportunity to try all these new projects that would not have been possible were it not for the pandemic. Like a lot of what Brian was talking about, those safe streets, shared streets, the parkettes. So being able to use or try new things, I think, would be my word of advice. In this instance, a lot of the projects that would never have been possible to try in cities now are finally available. So just trying them out as pilots that you can cancel if it doesn't work, get them out there.
I love it. Be bold. I love that. Anyone else?
I'll go next. I would just say that, you know, recognizing that we were in the middle of a pandemic, and for most of us, it's the first time we've ever encountered anything at this level, and it was scary and it was stressful. And I think that there were some knee-jerk policy decisions that were and probably will still be made as part of the fallout of the pandemic. Like one of the examples that comes to mind, not for California, but in other parts of the country, is the legalization of marijuana for tax dollars, because local governments are hurting right now and they're looking for sources of tax revenue. And while I understand that, there are you know, unintended consequences to doing that relative to highway safety. And that's just one of many potential examples.
I'll agree with Micah I'm sorry, Misha. And the other thing that I would say is that we should not plan our cities for 1 or 2 hours of the day, or 1 or 2 days out of the week, or 1 or 2 days out of the year. I mean, when you look at the amount of area dedicated for parking lots for the Black Friday, or how wide our streets and freeways are for that narrow window of transportation, let's think of policies, let's think of programs that can have similar benefits. I mean, you know, the amount of volume of traffic that went away because we're all, you know, not driving to this conference, instead doing it via Zoom, I think has an incredible ability to change our cities. And we need to stop thinking that we're going to pour concrete out of our problems. So that would be my call.
I love it. Thank you. That's great.
And I have just a quick comment to add. And Brian, I love what you said. Another thing that I think is important for policymakers to keep in mind moving forward is the cross-agency or discipline collaboration. It's something we've been talking about forever, but now we're finally seeing the need for the public health, with the transportation, with social services, and so many groups need to get together and more effectively figure out how to be working as a system to support the residents.
All right, I got one question from someone from the audience. Has citation data from the local police departments been considered in agencies that have low collision rates? Sometimes this is useful to identify the near misses and trends that may result in collisions in the future if they're not addressed.
I can quickly try. Oh, go ahead, Jake.
Sure.
I was just going to make a general comment relative to looking at that from a national point of view. So citation data isn't collected and put into a database in any way that can be aggregated and analyzed nationally. So that's always been a really interesting topic for us at AAA, at the national office and at the AAA Foundation, is to have the ability to analyze citation data. But even within a state, even within a county, it's not always collected and aggregated in a way where it can be analyzed meaningfully. It's a separate track, a separate effort that would have to be pursued. But if you live in a place where that happens and those data are available to researchers, that changes the game.
Oh, go ahead. Oh, go ahead, Dr. Grunbeck.
Oh, yeah, I was going to say something similar. And there is a problem with there's no standard for citation data, and it's reported differently and shared differently. Also, what is documented is different, so it's very hard. I've not seen much evidence that there is a lot that you can learn about that in terms of proactively responding to safety concerns. So it's maybe a future opportunity, but for now, I don't think it has too much promise.
Got it. All right, well, that concludes the discussion, the moderated panel. Thank you everyone for participating. Let's all give another round of applause to our 4 participant speakers. And with that, I'm going to pass it back to you, Courtney.
Right. So I want to echo your thanks for being our moderator, John of LA Walks. Just remind people of his great organization. I want to thank Dr. Grunbeck, Dr. Young from UC Berkeley and UC Davis, as well as Jake Nelson and Marianne Kim from Auto Club, our partners on this. I want to thank everyone for joining the webinar today. Hopefully you've been given some food for thought on efforts you might want to take to advance transportation safety during the pandemic and perhaps beyond. We want to encourage all of you to sign up for our second webinar in the series that's scheduled for next Thursday, November 19th. It's Building Partnerships and Generating Support, which will explore how collaborations between key stakeholders can help communities make inroads in reducing serious traffic safety collisions. I'll be sharing a link with all of you later in our email thank you, along with all of the presentations from today. So thank you again for joining us, and we hope that you indeed continue to stay safe and healthy. Thank you, everyone.